Welcome back to the PricePlow Podcast. We are more than honored once again to have Dr. Cameron Sepah back on the show, episode 122. As a brief recap, we first introduced him on episode 62. That's when you get the whole background. And then we brought him on to talk about what was formerly known as the Lover Protocol at the Maximus Tribe on episode 70. It has been, there's a lot of stuff to catch up on here, but it has been updated and he has changed it to the Blood Flow Protocol. And Dr. Cam, thanks for having us on, or thanks for coming on. We are going to be talking about prescription pre-workout here, and I couldn't be more excited about this. So how's it going?
It is going excellent. I'm so glad to rejoin you guys and talk about the world's first prescription pre-workout.
Now, is that even like a legal thing? Like, can you is having a bad pre-workout something you could diagnose as a disease or something like that?
I think if you talk to the gym bros, they'll certainly tell you about bad workouts. But certainly we know from the scientific literature that they can be enhanced. And the bodybuilding community actually for years has kind of used PDE5 inhibitors, which most people are familiar with, Viagra or Cialis or Levitra, off-label for the use of enhancing their workouts. But now, we figured instead of doing it underground, we have licensed board-certified physicians that are prescribing essentially these class of drugs for the enhancement of workouts, sexual function, and cognitive function. And I'm happy to talk more about that today.
Okay, so you're kind of making a shift here because before there was another ingredient, PT141, I believe, that helped possibly enhance libido. But we're really, at this point, it seems like you're making a shift towards like full-on blood flow and performance here, right?
Absolutely. It's a great point. So the original kind of version 1 of this formula was a combination of low-dose Tadalafil or Cialis with PT141 or bremelanotide. Bremelanotide is a peptide, which are obviously popular these days, that is typically used for libido enhancement, but it does have a synergistic effect with Tadalafil and enhances the effect of Tadalafil. So we were combining that in a sublingual formulation to enhance blood flow. We did find that it was effective, but we as a company are constantly investing in R&D. And we actually tested 3-4 different compounds and found of our existing client base, that they like this latest formulation better. And so obviously if it's improved, people are more satisfied. They're getting better results in the gym. We reformulated it with Tadalafil and a PDE5 that most people are actually not familiar with called Vardenafil. The brand name of that is Levitra or Staxin in the sublingual formulation. And those two have an even greater synergistic capability and enhance blood flow even more. And so we rebranded it as the Blood Flow Protocol as you worked out. And it's really geared towards people who want to maximize their performance or exercise performance in the gym.
Okay, so I'm looking at your page right now, the Blood Flow Protocol. You have 1 dose a day, 30 doses, oral or sublingual. Is this one sublingual tablet or do you take 2? And what is the time? Okay.
So this is a custom compounded medication, meaning both drugs are actually combined in a sublingual tablet. So sublingual means under the tongue. And the reason for this is twofold. So the first is when Vardenafil originally came out on the market, it was under the brand name Levitra, and it was an oral medication. So you'd have to take it about an hour before having sex in order to get the maximal effects. But they found that when you take it sublingually, it hits faster, which is obviously a lot more convenient when maybe you don't know when you're going to be engaging in a bedroom exercise, as it were. So Vardenafil, interesting, has a unique benefit. It has the fastest, what's called Tmax, meaning the peak plasma concentrations of it are 0.6 hours or about 36 minutes. Contrast that to Tadalafil or Cialis, it takes about 2 hours for it to hit peak levels. And so when you administer it sublingually, it basically hits as fast as possible. So we generally find with our clients who use this, you can take this about 15 minutes and start to feel the effects, which is very fast. And generally, it'll start peaking at around 30 minutes. If you want to be super safe, you can take it about an hour before going to the gym. But the nice thing about it is it hits so fast that you can generally keep it in your backpack, your gym bag, and essentially on the way to the gym is kind of the thing that I do personally. You just pop it under your tongue. It absorbs through the oral mucosa and it bypasses liver first pass metabolism, and it starts producing the enhancing effects.
Okay, I'd like to get into the mechanism a little bit more and like talk about the liver a touch, but so with the timing of this, then like 36 or so minutes before it peaks, does this if you miss the timing, can it like affect your warm-ups a little bit? Like it seems like you almost need to stretch into it or something like that. And I would think I'd want it to peak as I'm like hitting the middle of my workout when I'm like kind of stretched out a little bit more.
That's when it peaks, but the effects will continue to persist. So for Vardenafil, the half-life is about 4 to 6 hours. For Tadalafil, the half-life is 17 and a half up to about 24 hours. So it's an interesting combination, and we also selected it for this reason. Vardenafil is basically a short-acting PDE5 inhibitor, 4 to 6 hours, and Tadalafil is a long-acting PDE5 inhibitor that basically lasts all day. That's why the benefit of Tadalafil, if you're using it for sexual function, is you don't have to time it. You just pop a pill every day, and whenever you and the missus are ready, you're basically ready to go. With Vardenafil and Sildenafil or Viagra, you do have to time it a little bit because the half-life is 4 to 6 hours or 4 hours for Viagra respectively. But when you combine it, you kind of get the best of both worlds. You get the potency of Vardenafil. Vardenafil, by the way, is the most potent PDE5 inhibitor on the market. Its selectivity for the PDE5 enzyme is 10 times stronger than Viagra or Sildenafil. So it basically means you need to take a much lower dose. So as opposed to maybe 100 milligrams of, Viagra, which is very high dose, you can take single-digit dosages of Vardenafil. 2.5, 5 milligrams of Vardenafil is plenty potent for most people to have the effects. And so that's the beauty of it is you can time it, obviously, as a pre-workout, but let's say your schedule changed, something happens at work, you miss your morning workout, you need to go in the afternoon. The Tadalafil will still be working. You'll still get the majority of the benefits. Or let's say you take it as a pre-workout in the morning, enhances your workout, but you want to have fun time with the missus in the evening, the Tadalafil is still working. And so you still get the all-day benefit. So it offers a lot more flexibility. You don't want to be like neurotically like having to time medications all the time. But this is both sort of a pre-workout and an all-day enhancer all in one.
One of my favorite things about taking Tadalafil was the long stretch. I don't have experience with Vardenafil, but just in terms of using Tadalafil, I use it for blood pressure. And also, I think there's also a claim with prostate health as well. But correct. I used it just kind of like a 2.5 milligrams daily, just as a general health aid. Yep. And I loved that no matter what type of blood flow it is that we're talking about, I didn't have to time it really. So I could see this being really nice because if you want a nice pump from your workout, you could take it pre-workout. But if you didn't, like, you would still have great effects from this if you were just using it throughout the day.
Absolutely. And you brought up a couple of benefits that I think are really important, which is also the overall health benefits. But first, let's talk about the specific science when it comes to enhancing exercise performance, because this is what people care about. So obviously, people love pre-workouts and sort of muscle pump enhancers. Though a lot of people basically associate pre-workouts with stimulants, right? Caffeine obviously being the most ubiquitous and commonly used pre-workout. Now, the interesting thing about caffeine, though, is it's actually a vasoconstrictor in a lot of ways, versus PDE5 inhibitors are vasodilators, right? They increase the width of the blood vessels and increase blood flow and oxygen to the muscles. Now, this is a common question people ask. Well, if I'm taking an ED drug, am I going to get random boners at the gym? And the answer is no. You need sexual stimuli in order to get an erection. So just because you're enhancing blood flow doesn't mean you're going to get inappropriate erections. Unless you're totally ogling at some hot chick at the gym, you're probably going to be okay. So
and you're wearing sweatpants.
Yeah, exactly. I don't know. With all the gym fits these days, maybe a problem, but that's on you. You got to divert the eyes, as Joey Swola, makes all these videos about. Okay, but so what's the literature on this? There's been a lot of studies that show it's not only enhancing, obviously, blood flow to the genital region, but it actually enhances blood flow everywhere, including to skeletal muscles. And so people hear the term PDE5, but there's actually numerous enzymes in this family that go from PDE 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 up to 11. And they all have slightly different functions. PDE5 does enhance, obviously, blood flow to the genital region, but it enhances blood flow everywhere. And PDE11 actually has kind of more generalized effects. PDE11 particularly enhances blood flow to skeletal muscle. So Tadalafil is unique from Vardenafil and Sildenafil and the other PDE5 inhibitors. It has greater selectivity for PDE11. And so if you're specifically trying to enhance blood flow to your muscles, which is obviously what we're trying to work out and enhance muscular hypertrophy, Tadalafil is a particularly good choice for that. Now,
okay. Keep going.
Now, PDE5 inhibitors, there's a lot of research on it for the enhancement of exercise performance. There was a study that was done in adult males who were exercising that gave them a low dose of sildenafil or Viagra, about 20 milligrams. And they found some very interesting effects in that. One, they found that it increases the ability to do more reps when you're doing a set. So basically, they were arguing it delays muscular fatigue and enhances muscular endurance. So obviously, we're trying to maximize the amount of lifts that we're doing. And so if you're going for a PR in terms of the number of reps, it specifically PDE5 inhibitors have that enhancing effect. And that's I think, guy's dream or gym bro's dream is you want to be able to increase your performance. And it clearly has a performance enhancing effect. The second thing that was very interesting that was out of that study is that it shows that it increases muscle protein synthesis, which is one of the foundational mechanisms for growing your muscles. In fact, it increased muscle protein synthesis. I believe that doubled it, which is on par with what you'd see from the study author said 100 to 200 milligrams of injectable testosterone, which is a pretty remarkable finding that instead of having to inject, 100 and 200 milligrams of testosterone, which is a pretty standard to even high dose of testosterone, it was having as much of an effect on muscle protein synthesis as injectable testosterone. And so why do we not use sildenafil, which is what was originally used in the study? The reason is, as I mentioned, Vardenafil is about 10 times more potent, so you can use a much lower dose. And it generally has less side effects, we found, than sildenafil. A lot of people have experience, obviously, recreationally taking Viagra, in that it's very common to get headaches from Viagra. Sometimes people get kind of back pain. There's other sort of side effects. Because of the selectivity of Vardenafil, it inhibits PDE5, as I mentioned, more than any other drug basically that we know. You get the best sort of cost-benefit ratio of you get the exercise enhancement while reducing the amount of side effects because of the very, very low dose. And that's why we chose Vardenafil. And we chose Tadalafil because of the inhibition of the PDE11 that it really focuses on the skeletal muscle tissue.
Okay, awesome. So this might be, I guess this is a general question we could just ask about any like nitric oxide type ingredient or whatever, but if you're getting more blood flow to the muscle, are you getting less blood flow to other areas? Does that make any sense at all?
It's a great question. It's not mutually exclusive. So the interesting thing that Ben alluded to is there are other health benefits to it. In fact, there was a randomized control trial that shows that it increases cerebral blood flow or blood flow to the brain as well. So I actually think one of the most promising things about this class of medications is there's associational data. Now we have to caveat it because it's not randomized, showing that basically people who take PDE5 inhibitors have a lower risk of Alzheimer's and dementia. And it may be because it's enhancing that blood flow to the brain. Now, I think more research needs to be done in order to substantiate that. But what we do know, there was a randomized control trial giving this and looking at how does this affect cognitive performance in the here and now. And they actually found on basically all measures of cognitive performance, including memory, attention, and processing speed, it actually enhances cognitive function. And so this is also a very interesting thing because caffeine obviously is not only used as a pre-workout, it's the most used drug in the world for cognitive enhancement. Everyone takes it in the morning in order to focus at work. But again, as I mentioned, caffeine can be a vasoconstrictor. It's a dose-dependent and tolerance-dependent effect. But when you take a PDE5 inhibitor, you're enhancing blood flow to the brain. And so I would argue caffeine is really good when you need to pound out boring work and you just need energy. And it allows you to obviously focus more at work and at the gym. But it's not my favorite choice because obviously it can be very stimulatory. It increases stress, anxiety, and it shifts you into a sympathetic dominant or a fight or flight mode response, right? I think in the last podcast, I made this anecdote. If you listen to the great bodybuilders like the Dorian Yates of the world, they actually are very almost like genetically blessed in that they're very good at working out very hard. Obviously, promoting high intensity training was Dorian Yates' style, but they're very good at shifting to a parasympathetic state, the rest and digest state, when they're not working out. Notoriously, these guys would work out really hard, take like a 2-hour nap in the afternoon, rest, they sleep well. They're kind of calm, chill people when they're outside of the gym, which makes sense. You want to, destroy your muscle fibers in the gym, and then you want to rest, recover, and you grow your muscle fibers when you're sleeping, right? And so when you're on caffeine all the time, you're not letting your body shift back into that parasympathetic state that you need to recover, rebuild your muscle fibers, and grow. So I actually think most people overuse caffeine, especially if they're dosing it more than once a day. I think it's fine if you're taking a little bit as a pre-workout and then letting your body recover. But everyone is so sleep deprived. They're having their afternoon cup of coffee to get through the rest of the afternoon, and you're not letting your body relax, which is really important. As opposed to constantly pushing the red line with stimulants, I think the use of PDE5 inhibitors is actually a clever strategy because it doesn't increase your heart rate, it doesn't increase your blood pressure. In fact, Ben alluded to the fact that one of the benefits of PDE5 inhibitors is that it has a slight lowering effect on blood pressure, which most people are either hypertensive or pre-hypertensive these days. So the slight blood pressure lowering effect is generally beneficial for cardiovascular health. And in fact, that is actually another category of its benefits. Is not only is it helpful for brain function, as I mentioned, and cognitive function, is there's increasing research that's suggesting that it's cardioprotective, right? It protects the heart using these class of medications because of the blood pressure lowering effects, but it also seems to enhance endothelial function, right? The function of the blood vessels. Instead of having them be sort of stiff, it allows them to vasodilate, be a little looser. And so there's increasing research that potentially for the protection of cardiac events and other things, the use of PDE5 inhibitors may be very beneficial. So the interesting thing is I would actually argue, there's a lot of speculation around anti-aging sort of medications and treatments. I'm actually a huge skeptic of this, by the way, of this entire field. I think the longevity research is very poor. Everyone was hyping resveratrol as the next big thing and never really panned out. But ironically, Dr. Eugene Shippen, who's one of our advisors and has been practicing medicine for 50 plus years, argues that basically how guys used to take baby aspirin as sort of almost like a cardioprotective, like everyone should be taking a low dose of baby aspirin. He argues that PDE5 inhibitors are the next baby aspirin, and that basically all guys, regardless of whether you have ED, I don't have ED, but I take our protocol because I think the cardiac and brain and workout enhancement effects, not to mention obviously the sexual benefits are great as well. Even if you don't have ED, it does enhance actually sexual function in terms of allows people to go longer. The enhanced blood flow tends to increase sensation. So you increase the pleasure essentially of sex. And so most guys, even if you don't have trouble getting it up, so to speak, you do find a benefit obviously for that. Overall, I think the class of medication is very promising essentially as a enhancer of, if you don't want to use the word anti-aging, but just overall quality of life, health span, because I think the cost benefit of these drugs is very positive. And the last one I'll mention too that Ben alluded to is this class of medications is also helpful for the prostate. So as men typically get older, they do tend to find difficulty urination because of BPH or essentially a benign enlargement of the prostate, which is kind of annoying as you get older because, who likes getting up in the middle of the night to pee, and it's hard sometimes when you don't have a consistent urinary stream. Tadalafil and other PDE5 inhibitors do seem to have kind of a calming effect in terms of reducing the urinary issues that are associated with aging. And it's obviously beneficial when you don't have to get up in the middle of the night. You get better sleep. You don't get sleep interruption, and overall, it's going to benefit your health if you're able to sleep through the night.
Yeah,
awesome.
I mean, I know that there's a lot of people who come to this for specifically the pre-workout purpose, but like I cannot understand enough like how much it improves lifestyle for a lot of people. Like I have a family history of prostate issues. I took ephedrine a couple years ago and I had like a weird prostate. Like some people reported side effects on their prostate with that, like really, really painful ending urination and stuff like that. So once I found out from my family there was a history, like I wanted to make sure my PSA values were like sick forever. Right. I only take like 2.5 milligrams, but I think that the blood pressure drop, I switched from lisinopril over to Cialis. And I felt that just overall, I know I feel similarly to you with like longevity drugs, but I feel like I'm in a better position just long-term health-wise. Not that I need to take Cialis, but I feel like I'm doing something good for myself. And then the pumps at the gym are like, they're great.
Yeah, absolutely. And you bring up a good point. More is not better. I always constantly tell people this with medication, you know. There's a little too many TikTokers who are heaving, dry scooping large doses of pre-workout, heroic dosages, as they say. It's obviously just bad for you. You know, like the amount of stress that you're putting on your heart by overdosing on caffeine is just, you know, idiotic. I'm sure it gets a lot of clicks and views, but I always say, you know, the goal, if you're a responsible clinician, is to provide the minimal effective dose, the med, that gets you the most benefit with the least amount of side effects. All medications and supplements have a risk of side effects. It's just that some are obviously lower risk, and it's a dose-dependent effect, in that the higher the dose of any medication that you take, it's a higher risk of side effects. So we've done enough testing to show that basically low dose versions of this combination are very effective. So we have a low dose version, which is the 2.5 milligrams that you take of Tadalafil combined with 2.5 milligrams of Vardenafil. So that combination, which is 5 milligrams total, is, I think, enough for most people, essentially. That's the dose literally I take. You get sick pumps at the gym. You're able to do, you also feel it, by the way, more. Yes. Like when I work out at the gym, I'm like, I can work out harder and longer, which is just when I can just notice the difference, essentially, when I take it. And then the cognitive, benefits, and obviously the sexual benefits you notice later on in the day. We do have a 5-5 as well. There are some folks, they're either bigger and heavier. So obviously if you weigh more, you might need a little bit more medication. Or if you're just, you need a little bit more of that enhancement effect, you can take the 5-5. So those are both the daily dosages. And the thing I actually want to point out, which is a little different than how most people take supplements, because this is not a supplement. Remember, this is a prescription drug, is it's not just used before workouts. Now, there's a lot of guys, maybe like you and me, we work out 5-6 days a week. So it's pretty much, you're going to take it every day anyway. There's a lot of folks, though, who only work out 3 days a week. And so we get commonly asked the question, should I only take it before workouts? And the answer is no. You actually want to take it daily. And there's 2 reasons for this. One is that if you look at the pharmacokinetic data on Tadalafil, there's essentially a serum enhancement effect when you take it daily, because the half-life starts to overlap with one another on a daily basis. So when you take it on a daily basis, the 2.5 milligrams, which is a low dose, or the 5 milligrams that you're taking, is basically works better when you take it consistently on a daily basis, because you achieve basically a steady state in your serum levels. So when you take it daily, it's just going to basically work better on a more consistently. The second reason is, one of the things that I think is really interesting and emerging is, I think PDE5 inhibitors enhance recovery. And the reason that I think this is potentially true, more research needs to be done, is there hasn't been a lot of human studies, but there's been, interestingly, animal studies that, now we can't extrapolate to humans completely, but at least it's kind of promising when they're using it actually for surgical recovery, right? So when you go through surgery, there's obviously a lot of toll that's put on your body. There's a healing process that needs to happen. And when you enhance blood flow, it allows for all the new regenerative sort of molecules to get to the site that was surgically operated upon and heal. And at least the animal studies are at least promising and showing enhanced healing and recovery time. And so the idea is, yes, you want to enhance the pumps and the muscular endurance when you're working out, but even in your off days or your rest days, you want to have increased blood flow to the skeletal muscle. And why is that? Because of DOMS, or delayed onset muscle soreness, right? So even after you work out, if you do a hard workout, especially hitting that leg day hard, you're going to feel sore for 24, 48 hours. There's still a process that's going on in your body in terms of the inflammation that's happening and the healing that needs to happen to repair those muscle fibers. And so when you're taking it on your off days, or basically taking it every day, you're enhancing blood flow to those skeletal muscles, allowing for those regenerative molecules to go there and enhance the healing process. This is why, for instance, that we know that when you get a tendon or a ligament injury, there's poor blood flow to tendons and ligaments compared to muscles. Muscles, you can, tear it up when you do a sprint. And then generally in a few days, you're better. But when you kind of, inflame your tendons for weeks or months, you get sore shoulders just because there isn't as much blood flow to the area. So anything that enhances blood flow to areas that are in need of healing or recovery is going to accelerate essentially healing or recovery time. And so we always tell people, it's very different because they have to get out of the mindset of using it as an ED drug. With an ED drug, you're generally, especially with Viagra or Levitra, you're only taking it before sex. And most people, unless they're lucky, are not having sex every day. So they're only using it PRN or as needed. But when you're using it as a workout or a cognitive enhancer, you really want to dose it daily so that you're getting both the workout effects, but also the recovery effects.
Wow. Okay. So I got a few things to catch up on. So you had mentioned, I was thinking about stacking anyway. So going backwards, you had mentioned baby aspirin. Is that something that's at all part of your protocol at all? Or was this something that you would not mix with this?
It's not part of our protocol. You can obviously take it. Baby aspirin has basically blood thinning effects, which is why it's been commonly used for essentially the prevention of heart attacks. If you look at the meta-analysis, though, the effect is statistically significant because they had hundreds of thousands of men in their study. But the effect is tiny. It's a very, very tiny amount of risk reduction. It does, interestingly, have some synergistic effects with PDE5 inhibitors. In that if you take it with a PDE5 inhibitor, it may further enhance, erectile quality and function. I wouldn't say it's a necessity. I don't personally take it myself. But obviously, if you're having acute inflammation, like you're particularly, have a little bit of pain, then obviously aspirin can be beneficial for that.
Yeah, aspirin's like my first line of defense. Ibuprofen does work better for me, but I try to stick with aspirin if I can. Baby aspirin is just like 81 milligrams or whatever. So, okay. So while you're kind of, you're trash talking our pre-workouts, Dr. Cam, no, but a lot of people listening, obviously on this podcast will be taking pre-workout. Sure. Is it okay to stack in like pre-workouts? Yes. Or are there ingredients not to? Like, obviously most of them are going to have at least 3 grams of citrulline. A lot of them likely more. Sometimes there's nitrates out there. I think in the past we've talked about studies where they had very high doses of nitrates combining with one of these drugs and lowering blood pressure. So are a lot of your people using at least citrulline-based pre-workouts with this?
So yeah, it's a great question. I think citrulline and other basically like amino acids or amino acid-like compounds are pretty safe. The reality is citrulline doesn't give you very strong pumps. Like it's a very mild effect. I mean, citrulline is literally found in watermelon. If you consume a lot of watermelon, you'll get citrulline. I've never heard of anyone getting like painful pumps from excessive summertime watermelon. You know what I mean? It's a pretty safe compound for the most part, which is why it's over the counter. It's why it's in a lot of pre-workouts. And like I said, it has a mild effect. The thing I would invite users is look, obviously I'm biased, but try the product. There's a reason that some things are supplements and the other things are prescriptions, in that the amount of pumps that you're going to get, and Ben can vouch for them himself as an unbiased source, that you get from Tadalafil or Vardenafil is on a whole nother level than you will with anything over the counter. So it's almost like you're taking little baby steps or baby aspirin, if you will, with a lot of the over the counter pre-workouts, if you're taking it for pump purposes. Now, if you're taking it for the caffeine, that's a different thing. Sure, it's going to enhance your energy. And if you need that because you're tired or dragging, go for it. There's no contraindications between taking PDE5 inhibitors and caffeine. I don't think there's an issue with L-citrulline. However, nitrates you should be a little bit careful about. Anything that excessively drops your blood pressure may have a synergistic effect with the PDE5 inhibitors, and you don't want to drop your blood pressure too much, obviously. That's not safe. It's called hypotension or acute hypotension, so you want to do that. But my argument is this: when you're taking a prescription pre-workout, at least for the muscle pumps, you don't need to take anything over the counter to make it even better. It is plenty potent, and so again, more is not better. You don't need to stack a million different things. You already are taking 2 prescription drugs basically with this workout. I would not take anything that is a muscle pump enhancer on top of it. If you needed more, you can increase the dosage from 2.5 to 5.5. I would just say take maybe a simpler pre-workout product that is mostly focused around, caffeine, creatine, beta alanine, kind of all the basics, maybe a little bit of L-citrulline, that are just generally beneficial ergogenic aids for enhancing exercise performance. But I wouldn't take like a nitrosogene or anything that, is kind of in the nitrate-like family that may, have a little bit too much. The other thing I would say is like, look, you got to assess your own individual body. People have different reactions. There's lots of dudes who can take 12 different supplements and drugs and they're totally fine, and guys who cannot, right? This is like the Ronnie Coleman versus Jay Cutler. One turned out a lot better in terms of his long-term health. Now, maybe that's due to individual differences in genetics rather than training differences. But I would say I think every guy should have a blood pressure cuff at home. Just given the ubiquitousness of not only hypertension, but pre-hypertension, where you're kind of on your way to having hypertension, it's good to monitor. Just like I think everyone should monitor their blood sugar at least once a year. But if you have prediabetes, you should monitor a little bit more regularly to assess the effect of all of these compounds on your blood pressure. Another example, by the way, is minoxidil. Minoxidil or Rogaine, commonly used obviously for hair growth, is originally a hypertension drug. And increasingly, it's now popular to take it orally for hair loss, but it has very mild blood pressure lowering effects. The more of these like antihypertensive drugs that you start stacking on top of each other, it may cause blood pressure concerns. So the ultimate test is like measure your own blood pressure. You should know what your baseline is when you're not taking any drugs or supplements. Assess what it is if you are taking a prescription drug and or a supplement. And if you're stacking stuff on top, I would definitely monitor your blood pressure carefully to make sure that you're not getting too much in effect. And obviously subjective symptoms, you're feeling faint, feeling, lightheaded, all those kind of typical, hypotensive side effects you should just be very aware of. But I think, you don't want to engage in what's called too much polypharmacy is the clinical term, which are taking too many medications and supplements at once. What I do, and I'm a supplement junkie, just like you all just being in the industry, is I test things kind of one at a time. I see the effects that it has. If it's not working for me, I take it out of my stack. Right. And so my stack is actually pretty simple. I don't take probably more than, a handful of things, at least on the supplement side of things, because I try to keep it pretty simple. And if there are other things that I take, I'm only taking it for a short period of time to just test it, see the effects, and then take it out of, my stack.
Yeah, agreed. One thing at a time for sure. Ben might have a question here, but I was going to say, and maybe Ben has an answer to this one. Are you familiar with bodybuilders using this before getting on stage or anything like that? I'm sure that's a big thing, or maybe it's a banned substance.
In an untested federation, this is pretty off. In an untested federation, this is something that people would take like on a regular basis. It's not even like a pre-workout type thing. This is something that people have in their stack because the exogenous hormones they use honestly jack up their blood pressure so much that they need Cialis to bring it back down. And then the incredible pumps that you get are just a nice little, cherry on top while you're training, to be completely frank about it. And I think a lot of those people, just to piggy off the last discussion, if you're putting Cialis in, like you don't have to spend as much on pump anymore. Like you don't have to worry about grams of citrulline and nitrosine. Like in that case, most of these people are going to focus on things like literally focus, hydration, like other aspects of fitness. And Cialis kind of takes care of that whole category for those types of people. So I don't know about taking it like immediately pre. Most people are kind of worrying more about electrolytes and water at that time and carbs maybe, but absolutely tons of bodybuilders using Cialis.
Yeah. And my familiarity is less on stage, but certainly as a pre-workout. I think, in fact, I give credit to the bodybuilders. There's not a lot of research literature on this because, it's enhancement of workouts / bodybuilding is unfortunately not top priority for scientific research. And so even though I have mixed feelings about so-called bro science, sometimes the bros get it right and they can tell you a lot about the enhancement of their workouts. And so certainly as essentially an unofficial pre-workout, it's been used for at least, I would say, 20 years at this point. Viagra came out in 1998. So it's been on the market for 26 years. Tadalafil a little bit shorter, but I've at least heard in the last 10 to 20 years, bodybuilders, very, very commonly using Tadalafil. Vardenafil less so because it just hasn't been available on the market. In fact, we were one of the first companies to make Vardenafil available. It's kind of a I won't say obscure drug, but it's less commonly used because it's newer. And that's kind of the interesting thing, by the way. If you understand sort of the history of drug development, usually the first drug comes out, it's a blockbuster, as Viagra was. You got, Bob Dole walking down the beach promoting it, and erectile dysfunction didn't even exist as a category. Like people didn't even know, there was no term. They almost like had to educate the public that, hey, there's a magical pill that basically enhances, erectile function. And now everyone obviously believes that it's true.
Commercials with bathtubs. Yeah,
exactly. But what happens is they're like, okay, this is obviously a hit drug. Let's make it better. Let's work on newer versions that have lower incidences of side effects. That led to the development of Tadalafil, Vardenafil, and even better versions like Staxin, which is sublingual Vardenafil, which is essentially what we use. That, like I said, it increases the speed of delivery, reduces side effects, et cetera. So I think basically as bodybuilders too get clued in on, hey, Tadalafil's sick, but if I really want like a stronger pump, like greater PDE5 inhibitor, using a short-acting form like Vardenafil is even better. And I think sort of the top folks that I won't name names, but people that we work with find that it's better than Tadalafil alone. There is that synergistic benefit. And it's because of, like I said, the potency of the selectivity of the PDE5 is different. So for instance, 2.5 milligrams of Tadalafil with 2.5 milligrams of Vardenafil is going to be more effective than 5 milligrams of Tadalafil, because they have unique benefits and there's a unique synergy between the two. So again, you don't want to always overdo it, minimal effective dose, but they have sort of unique benefits, and the bodybuilding community, I think, is catching on.
Cam, since we last, this is slightly off topic, but since we last talked, Ben sent me a message. He's like, I got to try this. And I was like, well, you know what? Since we last recorded the podcast, I don't know if you're in all 50 states or whatever. Can you give us the quick update on Maximus in terms of where you're available at?
Yeah. So Maximus is, we're basically a consumer telemedicine company. You can think about us as basically an online doctor's clinic. So we have board certified physicians who work for our PC organization, and they're licensed in, usually all of our doctors are actually licensed in all 50 states. And then we work with FDA inspected pharmacies that will send the medication directly to your home. They're mail order pharmacies, essentially. I believe we're in about 46 states right now. There's a couple states, I believe it's like Alaska, Alabama. I can't remember the other two that we're not. You can just go on our website, you can check. But we're almost nationwide at this point. So yeah, I mean, it is a different, bar of regulation in that, these are prescription drugs. You have to be seen by a doctor. It has to be sent by a legitimate pharmacy. But by the way, that's a huge benefit. And I think this is really important for your consumers. And I think PricePlow in particular does such a great job of educating your viewership about there's huge differences between supplement companies. And this is really important because the supplement industry is incredibly unregulated, essentially. The quality difference is enormous. And we also know this personally because we create only one supplement. It's basically a prescription strength multivitamin called Building Blocks. And so we work with Leaf Labs, who you guys actually introduced us to, that has, great, CGMP compliant, great quality standards, work with a lot of the top brands. But we've worked with other brands, other contract manufacturers that were not so great. And it's kind of a Wild West in terms of the supplement industry. There's no guarantee, in fact, that you're getting the active ingredient that you were promised. There's no guarantee that the dosage is correct. In fact, some big brands like Now Supplements, Nootropics Depot, have called out a lot of the manufacturers in that they've went and done, random testing for melatonin and the dosages are completely off, right? And so unless you're using very trusted brands in the supplement industry, you don't exactly know what you're getting. On the pharmaceutical side, though, it is so heavily regulated that and the dosages are so precise, right? Like the 2.5 milligrams, 5 milligrams, there's a big difference between those two. You can't be off by a couple milligrams and call it a day. While with citrulline, because you're taking a 3,000 to 5,000 milligram dose, a few milligrams here or there, doesn't make any difference. With prescription drugs, it makes a big difference. Double the dose, you can have, side effects. And so the amount of regulation is huge because literally the FDA inspects each and every one of our pharmacies on a regular basis. They make sure that the sanitation, cleanliness is very high. All of the APIs or the active pharmaceutical ingredients that are imported have to be imported from FDA registered manufacturers so they know where the raw ingredients or supply is coming from. They're tested by third-party labs to make sure that they are potent, there's no impurities, there's no toxicity in terms of heavy metals. And so when you get something that is a pharmaceutical drug, it is super potent, and it is super pure. So that's the main difference, I would say, between the supplement and the pharmaceutical industry. And this is really important because you essentially have confidence that what you're taking is the real deal and that you're not getting toxicity. Great example of this, by the way, is omega-3s. So fish oil, obviously great supplement, tons of research on cognitive benefits and just overall health benefits for brain health and otherwise, and lipid lowering effects. So you can obviously buy that over the counter. There's a lot of supplement brands that do, but when they've kind of peeked under the hood, and you can tell this whenever you sniff, these fish oil, they smell fishy, and that's because they go rancid. They sit on the shelf for long periods of time, and fish oil, because it's an omega-3, it's an inherently volatile polyunsaturated fatty acid. So as a result, you lose some of the benefits because it's essentially going rancid. In fact, I would argue most of the omega-3s that are on the market are essentially rancid. Now, when you get the prescription form, it's omega-3 ethyl ester. The brand name is Lavazza. It's actually used as a lipid lowering drug because it has beneficial effects on your LDL. And I actually take the prescription form. Obviously, I can go buy it anywhere, Costco, any supplement. But when I'm buying the pharmaceutical grade, the dosage of the EPA and the DHA is very high. So you know it's very potent. And it's pharmaceutically pure because it's coming from a pharmacy and you know it's good. And it has a manufacturer created date, expiration date that's far off. And so it doesn't have the rancidity issues. So I just bring that up as an example of there's a different quality standard when it comes to pharmaceutical medications just because of the incredible regulatory scrutiny that the FDA puts on manufacturers and pharmacies.
Mm-hmm. Yeah. And just to give you a small snapback, it's not from our lack of trying or anything. Obviously, what's interesting is when you on our podcast, episode 100, you learn about the guidelines and the restrictions on the supplement manufacturers. Actually, they're under the foods, but the manufacturing guidelines are taken kind of from the drug manufacturing. The issue that we have is lack of enforcement. There's been a lot of things happening with not a lot of people ending up in jail, not a lot of people getting sued or bankrupted. And so it continues. So it's, when we go and head to DC, we joke that we are the only trade organization that actually wants the laws enforced,
Right. Yeah.
But I of course fully understand what you're saying. We just always, whenever someone says it's unregulated, we got to be like, oh, the regulations are there. They're just a lot of times not enforced.
It's less regulated. So,
yeah. Oh, for sure.
You're correct on that. And and obviously, look, I love supplements. I take a bunch. Mm-hmm. I just encourage folks to be thoughtful and just do your research and making sure that the brand has good quality control processes. I think this is honestly more of all the brands, for instance, that you guys promote are generally, good brands because they're, American brands, the owners, the factories are here. It's the flood of the Chinese brands on Amazon that it's particularly concerning, right? They whip up designs, they create these brands out of nowhere. And you can tell because if you try to Google if they have a website, it's complete. You can tell it was probably created by AI or something. It's not a real company. And they undercut people just based on price. On Amazon, and it's the same ingredient. You're like, well, it's the same ingredient, it's lower cost. Why wouldn't I buy that? It's because it's fake half the time, or it's adulterated, or they're misleading. There's liposomal versions of everything, and it's not liposomal at all. They just stick a bunch of fat or whatever phosphatidylcholine basically, and they call it liposome. I was like, it hasn't been properly mixed, and is it in my cells? None of that stuff. But nobody cares. Nobody checks. Nobody knows. And so, I use supplements all the time. I'm just picky about the brands that I use. I try to use American brands. There's a legitimate website. You know who the owners are. Mm-hmm.
I was happy when we don't even work with them or anything on an official capacity. But when in doubt, Now Foods, that they're testing all this stuff. They're ones coming after embarrassing Amazon, quite frankly. And they recently, you mentioned, I forget what you mentioned, but they've also done berberine and magnesium glycinate. Basically, any single ingredient expensive product, magnesium glycinate is not that cheap. It's rice flour, and the FDA is not. No one's dying over rice flour, so the FDA is not doing anything. No one's getting hurt, but you're not getting magnesium, which everyone needs. So it's an issue. When in doubt, just Now Foods it out is kind of the saying there on that one. But
that's a great one. You know, that's a funny thing. My mom literally texted me the other day. She's like, can you buy me some magnesium glycinate? I was like, sure, Mom. So I go on Amazon, and I was a little, I was like, my mom doesn't like to swallow these huge like horse pills, and magnesium, unless you're getting it in powder form, you have to take a lot in order to get 200 plus milligrams. Mm-hmm. And I saw this one brand, and it was like more potent than any other brand in terms of like the amount that you had to take. There's more like elemental magnesium per pill. And I was like, I don't know how they did that, because it's like generally 12%.
Right.
And I was like, I've never heard of this brand. So I Google it. The first thing that comes up is a class action lawsuit or something, because they're like, it's literally impossible to fit this much magnesium in a pill. And so someone sued because they're just like, if you understand chemistry, it's impossible. And I was like, okay, well, definitely not buying that brand. Let me go buy. I forgot what I buy. I probably bought Now or something like that. There's obviously other great brands. Right. Thorn is great. Designs for Health. We've worked with in the past that I think is great. Pure encapsulations.
Yeah, some of those companies are too big to not get sued or not want to get sued or anything. Doctor's Best, I think, has a good magnesium glycinate, stuff like that. Yeah, cool.
Life extension.
Yeah. So. Ben, did you have any other questions? I wanted to get back to prostate stuff if you have any time to cover that at all.
Had no questions.
We kind of veered off. Okay, so back to back to the blood flow thing. So I'd like to know, how does this help with BPH and prostate health? And I know a lot of people get their PSA levels checked. That seems to be the biometric that's used to measure this. I'm not sure. Like, are there any direct correlations to any of these types of PDE5 inhibitors reducing PSA itself? And is PSA is that like a bulletproof indicator of actual having prostate issues or BPH? Like, so can you connect some of this glue here? I recently had my PSA test and it was like 0.1. So I'm not worried. It's just,
fantastic. Yeah.
Thank you. Yeah. So at least that one thing I'm doing is working, but yeah, can you kind of glue some of this together, and how does PDE5 inhibition work? Cause a lot of people listening to this around my age are starting to have to wake up in the middle of the night to pee, and no one likes that. So solving it's a nice thing.
Yeah. There's usually two classes of medications that are used for the treatment of BPH and nocturia, which I believe is the clinical term for nighttime urination. So one class is the PDE5 inhibitors that we're talking about. The other class is the 5-alpha reductase inhibitors. So people are familiar with this in terms of finasteride or Propecia or dutasteride, which I believe the brand name is Avodart, if I'm not mistaken. So both, they work in different ways. So the 5-alpha reductase inhibitors are typically used for hair loss drugs, right? What they do is they block the conversion of testosterone to DHT or dihydrotestosterone, which is a more potent agonist of the androgen receptor. Now, in folks that have enlarged prostate, there's some suggestion that DHT, which metabolizes from testosterone, promotes prostate growth. Although I will say this is a debated thing in the research community, but anecdotally, when people take finasteride or dutasteride for BPH, they do typically find symptomatic relief in that their prostate volume or size shrinks. And so the frequency of the urination, irritation of the prostate all seem to remit. Now, challenge is in a very small segment of people, like literally probably I think it's around 1%, if I'm not mistaken. Some people do experience side effects, typically called post-finasteride syndrome, and that they get sexual dysfunction. We don't really understand why. There may be something with the effect that it has on androgen receptors, but generally speaking, they are actually a very safe class of drugs. I mean, they've been on the market for decades for people who've been using it for hair loss, and it also has the benefits of improving BPH as well. I actually generally think a lot of guys who are enhancing their testosterone should actually consider a 5-alpha reductase inhibitor, because not only does testosterone increase, you're increasing your DHT. And when you increase your DHT, if you're already prone to androgenic alopecia, meaning your hair's falling out, or you're prone to acne, DHT seems to exacerbate pre-existing predispositions to acne and hair loss. some guys are completely fine. They can take massive amounts of, steroids, and their hair and skin is great. God bless those folks. I'm not one of those folks. When my testosterone gets a little too high and DHT gets a little too high, start breaking out, even though I'm obviously an adult and don't get acne otherwise. Same, and then hair loss starts exacerbating. So 5-alpha reductase drugs are both great for the hair and the prostate. Now, the PDE5 inhibitors have less side effects than the alpha reductase inhibitors, and they have all the benefits that we talked about previously on this podcast. And that they also seem, through a different mechanism of action, to have effects in terms of controlling sort of the prostate growth and size, and it just alleviates essentially that urinary function. I don't know if it has direct effects on PSA, to your question. That's an interesting question. I'll have to look up the literature on that. I'm not aware of any literature. Doesn't mean it doesn't exist. But I would say PSA as a marker is also sort of controversial in that it's not like, I would say, like A1C, where there's a direct linear correlation where the higher it's going, the more insulin insensitivity that you're experiencing, where that if you're starting to creep up, you're developing prediabetes. If you're above a 5.7, you're developing diabetes. With PSA, if it's sky high, then yes, it may be indicative of prostate issues and or prostate cancer. But short of like extreme elevations, it's unclear if, the difference between a 0.1 and a 1 is actually indicative that, there's dysregulation happening at the prostate. So it can be a little bit of a red herring or a false signal, so to speak, in that I think sometimes people see elevations in PSA, they freak out, and it's not necessarily indicative of prostate cancer. And you got to be a little careful about this too, because, if you have to get a prostate biopsy, it's obviously very painful and invasive and can cause, sometimes the cure is worse than the condition, and can mess things up even more, which is why even like prostate cancer treatment is controversial, because it may cure your cancer, but if you're, killing your erectile function as a result of, messing with, the prostate and doing surgery, you've ruined your quality of life. And the reality is, like, if you live long enough, you're living to 80 plus, like 1 in 2 men are going to get prostate cancer. The good news is that it generally doesn't kill people. It's a very slow growing cancer, and, you probably will just live with it, and you're probably going to die of something else entirely. So sometimes I think the over focus on testing biomarkers that are not necessarily actionable, or you don't necessarily want to act on them, you got to be a little bit cognizant of. So that's why, like, I definitely suggest people get their blood sugar tested on a regular basis, blood pressure, and their testosterone. PSA, unless there's a reason to test for it or you're getting up there in age, not as important in my subjective opinion.
We appreciate that because you have clinical experience, so it's helpful. I guess, do you have any anecdotal experience, or have you heard of people on this blood flow protocol getting up to pee less in the middle of the night? Is that possibly?
Yes.
That's pretty cool.
We know that very clearly from the clinical literature on Tadalafil and other PDE5 inhibitors. It does significantly improve nocturia or nighttime urination. Now, we don't prescribe it for that purpose, right? We're not in the business of sort of sick care where we're treating your prostate issues. I will caveat it. It's a cherry on top or a bonus, so to speak. If you're having significant prostate or urinary issues, you should talk to your primary care physician or go see a urologist, because, you just want to make sure you don't have something else. You don't have a prostate infection, sexually transmitted, infection, or something that's like actually causing an exacerbation.
Right.
Because frequent urination can be a cause of other things, including an infection. So you want to make sure that you're ruling out an underlying cause, especially if it pops out of nowhere or it's exacerbated all of a sudden. So make sure you're doing your diligence. But yes, if it's just like, I'm getting older and I'm going to, getting up to pee a little more often, then yeah, it'll probably have that as sort of like an ancillary benefit. Now, the one thing I'll say about PSA, we actually started doing PSA testing, interestingly, for another one of our protocols, which, we talked about on another podcast, for our new testosterone protocol, more as a safety measure. I don't even think, we were talking to some of our advisors, and a lot of them think PSA testing is unnecessary, but it is commonly done with testosterone. Whenever you increase someone's testosterone, people are always concerned about PSA increases. Usually doesn't increase, or it doesn't increase that much to a clinically meaningful degree. But just to be extra safe, our new lab testing protocol for the new testosterone protocol does measure PSA. Before, we take a baseline, so we know what your PSA is before starting the treatment. And then, after 30 days, we retest you to see if your PSA has become significantly elevated. Now, most of the time it doesn't, but like I said, it's a kind of a precautionary thing that we do just to be safe and just practice sort of clinical best practices.
Excellent. And just so everyone knows that you do have an updated testosterone protocol that's in the works of coming and everything. We are going to have a second episode of this that we've recorded and probably going to re-record because things keep changing and everything. And we have a lot of good questions on this one. So you'll definitely want to stay tuned to the podcast there. Now, back then I think you were doing like finger prick based blood testing for PSA and all this stuff. Like, are you now sending people into LabCorp for that? Or like a Quest Diagnostics?
We have an amazing revolutionary device. It's actually an FDA approved blood collection device. It's not a finger prick, actually. We tested that very early on, but there's two issues with it. A lot of guys obviously have very thick, calloused fingers, and so they're not able to squeeze the blood out. It's painful and annoying, even if you're not, pain phobic. It's not pleasant to do. My dad's actually type 2 diabetic, has to prick his fingers every day, and I was like, it's good motivation for me to never get diabetes because it's annoying. And then third, if it's collected on a dried blood spot and then sent in the mail, heat and other variables can mess with the results. So there can be reliability issues when it comes to the accuracy of dried blood spot testing. And a lot of, unfortunately, other telemedicine companies out there, you should be very skeptical if they're measuring their testosterone through a saliva test or a dried blood spot finger prick test. They're notoriously inaccurate. I just think it's criminal, to be honest, because it's, how are you treating people if you're not able to accurately measure the biomarkers that you're trying to change? So what we do with this medical device, it sits on your shoulders, almost looks like a CGM. You press a big red button. It uses microneedles, so it's actually virtually painless. And it's getting whole blood. It fills up a tube just like you would when you get a phlebotomy. It's a smaller amount of blood than doing an intravenous draw, but it's way more convenient because, first of all, you can do this in the comfort and convenience of your own home. Second, you don't have to stick a big needle in your arm, which, it's never uncomfortable. I've done it 100 times at this point, but it's not fun. This is, like I said, you barely even feel it because it uses this microneedle technology, and it extracts about this much blood, maybe like the size of about half of your pinky, into a tube. And you just shake it up, seal it, mail it off. It's prepaid next day FedEx. And so literally the next day it arrives in the lab. And typically within a day or two, they're able to analyze the results. So it's very fast. So all in all, 2 to 3 days from literally your house to the lab, we can get the results back. And so it's amazing technology, and it's really cutting edge. It's only developed in the last, I would say, 5 years. That you can basically do virtually painless, non-invasive, at-home testing that is clinically accurate. And like we talked to, the PhD that runs the lab on a regular basis. They are top-notch. It's one of the top, essentially CLIA-certified labs in the country, and they're meticulous about the accuracy. And they've done validation testing, essentially comparing it to Quest and LabCorp, which you alluded to, which are the two big players in the space. And the accuracy is like 99% plus in terms of the correlation between at-home testing, because it's whole blood, right? And so it doesn't really matter measuring whole blood through this part of the arm or this part of the arm. Whole blood is whole blood. And it uses the same SST tubes, EDTA tubes. These are sort of the reagents that are used to collect blood. The only difference I would say between what we do in terms of at-home testing versus a Quest and LabCorp is just because of the volume of blood, we can only measure so many markers. We measure about a dozen markers. So out of curiosity, for people who are I'm just curious about some of our other protocols. In the testosterone protocol, we measure total testosterone. We measure SHBG. We calculate free testosterone on the basis of those markers, which is the most clinically relevant. I always say free T is more important than total T. We measure LH, which is an indicative of your body's ability to produce its own testosterone. The cool thing about enclomiphene, the drug that we use, is unlike TRT, stimulates your testes to produce more of its own natural testosterone. So LH is maintained. And also FSH, follicle stimulating hormone, stimulates the testes to produce sperm, which is also maintained or increases. So it maintains your fertility, which is a huge advantage over traditional injectable TRT. So we look at LH, FSH. We measure estradiol or estrogen. And with the new protocol, as I mentioned, we measure PSA, we measure hematocrit just to be safe, even though it doesn't significantly increase hematocrit. And with the weight loss protocol, we also measure A1C, which is a proxy for your blood sugar levels. So we also do the GLP-1 agonists. A lot of people have heard of semaglutide or tirzepatide, or Ozempic, obviously the hot weight loss drugs. Those also require blood testing and monitoring. So on a per protocol basis, we measure different markers. With the blood flow protocol, which is what we're here for today, there's no blood testing that's necessary. You just have to make sure, when you go through the flow, you report your medical history, and that, for most people who are relatively healthy, it's fine. There are particular contraindications. There's some people who can't take PDE5 inhibitors, but we'll figure that out. That's obviously up to the doctor's discretion to decide. But there's no blood testing or lab testing that's needed for blood flow. It's only for testosterone and weight loss, because those are a little bit more involved and they need a little bit more monitoring.
Right. And the next episode, we'll definitely get into that and everything. If I could play doctor for just a minute, I think the one thing I would add to that list would be zinc, serum zinc, because if that's low, that might be slowing things down. I know you've gone into some of that stuff too, though, and maybe you just have to assume that a lot of people following you are supplementing, eating meat. I don't know, you can't do it all for them.
No, it's a great point. And actually, the one marker that I forgot to mention that we're adding to the panel is vitamin D, which is absolutely critical. The interesting literature on vitamin D, I actually think vitamin D is probably one of the most important things you can supplement, just because no one is outside in the sun enough. I live in LA. It's like sunny here. I literally live on the beach. And so I'm like, oh, I should be good because I'm nice and tan. I did an experiment where I stopped supplementing vitamin D. My levels dropped to 29 nanograms per deciliter. 30 is actually the cutoff for deficiency. So I was literally vitamin D deficient, even though I have good melanin and sunlight. Which blew me away because I was just like, wow, I didn't think it mattered that much. It's just because we stay inside too much all day. And we did a study here in LA, 66% of people were actually vitamin D deficient and 100% were suboptimal. I would argue optimal is like 50 plus, 45 to 50 plus in terms of nanograms per deciliter, because it shows it has the, a significant reduction in, for instance, like COVID severity and other markers of immune function, essentially. So I argue pretty much everyone should be supplementing vitamin D, along with vitamin K2 to make sure it's going to the right places and other cofactors that enhance absorption, the other lipid-soluble vitamins as well. To your point, vitamin D will not increase testosterone on its own, but if you're deficient in it, it is one of the precursors. So it can help if that is an underlying cause. Addressing your vitamin D deficiency can help increase testosterone, just as addressing zinc deficiency, to your point, zinc and copper deficiency, they usually take those two together, can improve testosterone as well. So what we do with our building blocks, we have zinc and copper basically in there. And so if you take the multivitamin, there's basically no way you're going to be zinc deficient. And so it kind of takes care of that.
Mm-hmm. Cool. So I think we're about at the hour that you wanted to be at. I'm not sure if Ben has anything else, but like as I look at the blood flow protocol page and everything, like basically like you have this array of benefits that's starting to add up. You have like the workout pumps, meaning you could like actually save money on pre-workout and almost just switch to coffee or energy drink if you really wanted to. Not that we're endorsing that because we love our citrulline and everything, but that can come with obviously the better sex, the focus, and then also the reduced peeing at night. Like that alone, I think for a lot of people is going to be awesome because it was starting to get annoying for me before I like fixed all that and everything. So I think like all these things all together make it like a very worthwhile investment on top of just like people are very happy to just get that pump in the gym.
For sure. Yeah. And look, I invite people to try it out. The nice thing about, this class of medications, it's relatively safe. Obviously if the doctor approves. So try it out. I would say try it out for 30 days, give it a nice run where you're taking it daily, as I mentioned, to enhance your workouts and your recovery. And the proof is in the pudding. I think you'll be very satisfied.
On our way out here.
So Dr.
Sorry. I have one kind of like last question when I think about this stuff. Usually towards the end of these, I start talking about how I want to try these things. And Mike is kind of always on the other side of like, I don't want to add things in if I don't need them. Like Mike's obviously a healthy guy and is at his age and doesn't need these things. I know the answer to this question, but I'm trying to spark this question so that we can make sure people hear this. Is there any concern with taking this about our bodies not creating the things that, are involved in these pathways? If I take Cialis.
Yeah, it's a great question.
Yeah, for people are definitely concerned about that.
Yeah, I mean, it's different. I mean, I think people get that notion from injectable testosterone replacement therapy, right? When you replace your own testosterone, your body stops making it because of the shutdown of the HPA axis, the HPG axis. In this case, that's not true. It's the inhibition of a particular enzyme, right? Which is PD5, PD11, as we talked about. There doesn't seem to be a lot of tolerance or dependence with this class of medications. Obviously, lots of people take it as needed, but even the folks who take it daily, I've discontinued taking it. Yeah, there's no like rebound effects. So I don't think there's any particular, effects. We wouldn't sell anything essentially that has addictive tendencies or creates any sort of dependence. I just think clinically and ethically, it's not great. It's why we don't do injectable TRT. It's why we don't do Adderall and other things, especially because we're, working online. It's a, little bit, there's a little bit more caution, I think, that we need to exercise. So in the relative scheme of things, like I said, all medications have side effects. The side effect profiles of this in comparison to other medications are relatively better, but obviously it's up to you and your doctor to make that decision for yourself.
Awesome. Thank you so much.
Thanks so much. So, Dr. Cam, where to find you? And let's talk about the Maximus tribe. You're big on Discord and everything. I think that's your main community area. So, give us the download on how to follow you and join your crew.
For sure. Go to our website. The company's Maximus. We call our community the Maximus Tribe. So you can find us at maximustribe.com. That's our website. And then you can find me on all the socials. It's Dr. Cam Maximus. I'm pretty active on Instagram, a troll on Twitter. So feel free to ask any questions, and I'm happy to answer them.
We need to have a fun podcast where we just make fun of soy-fluencers, as you call them.
We can definitely do that. Unfortunately, there's so many health influencers with MDs and PhDs like myself who put out bad science, and I think it's really important for people to not just trust, including myself. People just because they're a med school professor. I mean, sure, it helps in terms of credibility, but you got to read the primary research for yourself. And especially, I think a lot of people who are making a lot of money off of their podcasts do not always have their best interests of yourself in mind. So I would say, be a scientist, be healthy, skeptical.
Okay. So in the next episode, when we have you back, we are going to be talking about the testosterone protocol. And then we will have after that an episode dedicated to ball sending. All right.
All right. I might skip the last episode, but I'm very much looking forward to talking about the revolutionary testosterone protocol. It is actually a game changer. We were able to achieve something that nobody scientifically believed was possible. And I'll basically tell you that there's a very safe and effective way of increasing your testosterone in a way that nobody thought was possible. And very excited to share that with you and your community.
Can't wait.
Awesome.
Awesome, guys.
Thank you.
All right. Thank you.